Hi, I've just traveled all the way from Malaysia to the Southern Thailand Elephant Foundation Veterinary Hospital. This is a NGO for domestic elephants in Thailand. Obviously, treating elephants is an expensive business, so this NGO set up this animal hospital to treat these elephants in need of veterinary care for free, basically. So this is the South Thailand Elephant Foundation Veterinary Center, and behind me you can see a stable with currently they've got 4 patients, 4 elephants. All are female elephants. 3 of them with colic and 1 with a cracked front toenail, and they're all here for treatment. And I will introduce you to the head of the veterinary hospital here, a friend of mine, Dr. On, and her veterinary team. I'm here in the vet hospital, and I'm going to introduce to you the 2 ladies who are going to introduce themselves. These are the staff from the Southern Thailand Elephant Foundation.
Hello, hi everyone. My name is Phang. I am the volunteer coordinator at Southern Thailand Elephant Foundation.
And how long have you worked here?
I have been working here for like 8 months now.
Okay, and you?
And me? Hi, I'm Ming. I'm the vet at here, and I started working here same as Phang.
Okay, thank you.
Và trong đấy tôi đã là lão chạy cao rồi tôi đã tập tao trong cửa lão lương mất đó
Currently, the Southern Thailand Elephant Vet team, they are preparing to give some medication to the elephant behind here, and that's the one that's suffering from severe colic. The gut motility has slowed down a lot, and they need to get the guts moving and all the digested food moving through the guts to stop constipation. So they're just preparing the drugs now, and they will be giving a huge amount of injections because everything for elephants are in large quantities. So there's elephants in the stall.
So I'm gonna open the vein for Chandi now.
Right.
บรรเลงเพลงหน่อย
สรุปพี่อ้อยจะบริจาคเครื่องปั่นยาไว้เนี่ยพี่อ้อยอ่ะไม่รู้อ่ะไม่มี
เอ้ยทำตาเลยดูมึงแบบนี้ตัวเดียวแต่ปกก็ปกตีนแต่ต้องปลุกมาจิตมา
ยังไม่เสร็จ
มา
ยังไม่เสร็จเลย
ยุ้ไม่เน่งดูแก้วมา
เมื่อคืนเขียนรายงานเว้ยแล้วต้องไปเอารูปบุญทรัพย์แล้วกูเห็นปัดแก้วมัน
นึกพอเห็นตาแก้วคือคำแรกที่นึกคือกาเจ็บปะ
เจ็บเปล่าพูดบ่อยมาก เป็นสโลแกนอะมาถึงต้องได้ยินคำนี้
ไม่ไหลเลย
What's the name of this patient and why is she here?
So this one, her name is Chandi, which is like 45 years old female from Phuket, from the elephant camp. And then the owner just informed us about her chronic issue, which is like she hasn't slept for 4 to 5 months, which is like she got a problem on her nail crack, which is like infections on that. Yeah.
And when you say did not sleep, it means that she did not lie down to sleep.
Yeah, exactly.
So which means that she's been standing up to sleep for
Yeah.
4 to 5 months.
Yes.
Okay. And what is the treatment for this animal?
So first, when our patient arrived at the hospital, yes, of course we have to put there on the scale over there, the big scale over there, so we can have the body weight of them. And then yes, after that we did blood sample for the test and to see the direction how it's going of the treatment. And then part of that, yes, of course, because the lesion of the issue is like local thing, like topical thing. So we check it up on the lesion on her nail crack on both feet in the front one. And then after that, after we get the result of blood, so and then we just like start with antibiotic, of course, because she got like a pus came out from the nail, and then which is like it's pretty cracked on both digits. And then after that, yeah, we provide the anti-inflammatory as well. After 2 days of anti-inflammatory, while vein plus with antibiotic, and then she could lay down to sleep like natural recompensi, yeah, something like that. And then the protocol and also future plan treatment of this case is just like day by day, because the point is she hasn't trained to be like lift her legs up.
Right.
So we have to like trim the nail, and then also divide the necrotic things, and then clean, and also we do like a foot bath as well.
Right. So is she a good patient or she's a difficult patient?
I think she's quite tame, quite friendly, but the point is she hasn't trained to lift her leg up.
Right.
So that's gonna be like difficult issue for us to, trim
The hoop, if you cannot
yeah.
lift the leg up. Okay.
Yes.
And how long is she expected to stay in hospital?
I think for me like at least couple months.
Okay. Okay. And then the food and everything is provided by the hospital.
Yeah.
Okay. Does she use a lot? She doesn't need drips, yeah, of course. Does she need drips?
Yes, but not that much, because during the day she has good appetite, and drinking is normal. Urination and also defecation is normal, but she got the drip because of only like provide the medicines.
Okay.
Yes.
Okay. All right. Thank you.
You're welcome.
So which toenail are you going to treat?
The left foreleg.
The left foreleg, is it?
Yeah, both foreleg actually.
Okay.
She has a lot of nail problems. Her nail is so long, and like at the corner of the nail, sometimes like it's really smelly and then like open inside. So we try to open it.
Okay, and flush it.
Yeah.
Okay.
I have been open it a little bit yesterday, but only can do a tiny bit because
Okay.
we try to kick it.
Yeah. Yeah, being kicked by elephant is no fun. Huh?
Sure.
And she knows that you're going to give her the treatment already.
Yeah. I think the thing that you get from working in the hospital that animal hate you.
Of course,
Always.
always.
Yeah, ngon nha. Nàyอยู่ไหนตีนไหนฉันต้องไปนั่งบริการของใช่ไหม
ใช่อยู่กลางแดดเลย
กันแดดเลยจำบ้านเขาให้ฉันอยู่กลางแดดไปนะตั้งได้ไหมนี่
น่าจะขับน้ำลายแล้ว
Can you smell it again?
Home.
How is it? Rotting, is it?
Not so bad. Better than
I can't smell it.
no.
No. No.
Just a little bit. The first day when we open, oh no, my God,
Okay.
this like a few days.
But you guys are the one that's following the case, so you know better than me. The next step is to try to taste it. The next step is to...
We're gonna do enema first,
Right.
and then I will give anti-ulcer first, and then painkiller
Okay. Anti-ulcer for?
for preventing, because when they have colic, they're gonna eat less
Right.
or none.
Oh, I see. So then they get gastric.
Yeah.
Right.
So,
Okay.
and then because I gotta give painkiller, which is like funicin megumi. It can cause of GI ulcer.
Right. I see. I see.
So I
I
have
see.
to give
Yes.
anti-ulcer first.
Right. The prophylactic at least.
Yeah.
Okay.
I like
Nó nín đều. Buồn không? Ai mà nữa?
What they're trying to do? First, they're going to go try at the concrete. Now they try the tree.
Chưa đây là.
อ๋อพี่ tiger, because we gotta provide fluid.
IV?
Yeah.
Okay.
เป็นไง
หน้าตาซีดคนนอนคนนอน
22 วันแล้วไม่ได้หยุดเลย
ว่าหน้าตาไม่สดชื่นเลยใช่ไหม
เหนื่อย
mine up here. Oh no. Oh. Oh, miếng kìa. Con putih. Ini lah mesti anti kan bukan boleh. Ini, anak lumun juga ni lah. Nan, lumun galang. Anti mun ni, mun kun boleh. Lắm cái đó. Đây, tình chân là mấy cái.
Mà đây là một trái này, một trái là cứแบบว่าcái trái cô nó dẻo.
How much fluids are we giving?
I would give, I think about 2 boxes. It should be 20 liters.
Right, okay.
But I'm not gonna wait for 20 liters, but just wait to see.
That they can do it properly.
Yeah, after I provide painkiller or anti-inflammatory, and then also the cholinergic
Right.
stimulate the upper tract
Right.
and see how it's going because she could fart many
Right.
times already today, but
Cục phiền cái này trời.
and then due to like she hasn't drunk water yet today.
Right, wow,
And
okay.
then we'll see. I mean, after give painkiller and she is how it's going.
Right.
Kệ. Này nó. Xếp. Bỏ đi được rồi.
19 em đấy.
ขอฟังเสียงเขา
So for the rest of the bottles, after 2 bottles, the owners will change the bottles themselves.
Yeah.
Alright, okay.
Đừng là tốt, đừng là tiếp cuộn mấy là
Cho cái luôn.
lúa lên đủ để rồi tiếp anh ấy.
มาอยู่นี่หน่อยกันเดี๋ยวล้วงมัดขาขอล้วงหน่อย
Mẹ còn trồng. Đấy nó. Được ra rồi. Trồng này. Nè, có đồng ý từ đó ra quả mà đi rồi chạy phi á. Cái reflex từ đó nó dùng.
Ồ. Răng máu. Mà đôi mới nè. Hả? Răng máu. Có đi đâu. Điện.
Nó lạ không?
Điện.
So do you hear any gut motility? How is it?
Both.
Both sides?
This one I can hear like a ping sound, like a water drop,
Right.
ding ding, and then both still motility.
Right. Both sides.
Yeah.
Yeah. Okay.
And then I can feel a little bit warm from her ear, and then we will do.
Right.
Das wird mal irgendwie abgehandelt. Also immer so geben die Ärzte mit einem armen Elefanten.
Yep. And we like people with long arms.
Yes. Oh, you think this is a long arm?
Bye. So that's what we are going to see now.
Yeah. Long arms are good.
I actually have quite long arms.
How are you?
I'm good.
Haben wir oben hier Katheter gelegt? Schon mal den
Mày chắc này đâu? Ồ, má, làm má, ngon quá.
Ồ.
Kia nghe tao đó. Mấy phương là tao đi. Tao này đi.
Quá rồi. Ồ.
Ooh.
Ồ, niên.
Cái này bộ luồng nó và mấy lỗ mà cái gì nó thể qua mấy bông đấy.
Luồng gần đâu?
Có luôn nè.
Mấy trứng không?
Mấy trứng.
Mình mấy mà gì nó và nó.นี่พุ่งมันนวลของเพลวเนี่ย
Cũng giúp rất này.
นี่นี่
Dòng của mà con.
เป็ดงูไม้เลย
Ồ, niên. Được chưa? Dài lắm. Ồ.
ฉันก็รู้นะเฮ้ยแต่ฉันก็ไม่ทำอะไรนะฉันก็บอกว่าไม่ได้บุกการ
Đây này. Ồ. Có mua bóng kính nè. Rồi.
Không thế nào đâu.
Có thể là băng bay đó bên đây rồi đi không? Băng rồi đi.
Nếu mà đi, bố mẹ ta sẽ mẹ đọc được đi cua tay. Giờ đến con gấp chân.
เอาเลยเอาอันนี้ไหม
Đây, đây không? Ồ,
โอ้ตายคนเหนือดินแบบนี้นะ
คนอะไรนะ
คนอีสาน
คนเหนือโอ้โหน้อยนิดเดียว
เป็นเจ้านกชนบอกเลยนะ
Is he testing, is it?
Because the guy who wear glasses, he's like gambler.
Right, right.
So he got 4 points. Which
Okay,
is like before him, he got only like 2 points.
right.
And then it's gonna be him. So if you lose, you have to pay him.
I see, I see. Four.
Same.
Four.
Ông ơi, tiền ơi, ơi.
เล่นหมุนไม่เป็นทำยังไงอ่ะ
Nó là con tôi. Có tiếng là đầu nữa.
It's lead,
Lệch à.
steel.
Mình đâu nhận đi. Đấy. Đâu đúng rồi.
ไม่มีโชคด้านนี้จ้ะ So he's a gambler.
Right. He's the expert.
Yeah.
So basically, they need to curve it around and hit as many as possible.
Yes. So if he hits as like get more points.
Then it's harder for other people to win.
Yeah.
Is it testing or what? So how do you know then when is the real try? Oh, so waiting for the money to come out.
The money is on the table.
Wow. How many? 3.
2.
2.
Because it's 8 left.
I see. There's 11 now.
Really?
Yeah, 11.
So he hit 3.
Yeah.
กล้องทั้งวันเลยไม่ได้
Kid, you wanna try?
No. The elephant children behind me is being discharged today, and she will be going back to her normal operating area, which is in trunk, and they'll be transporting her on a truck. And currently, the elephant is being prepared to be loaded onto the truck. They've got the ropes and everything so that they can secure her onto the truck. And you can see the truck in the distance down the slope. This will be a transport truck. And Trung is about maybe 6 hours drive, 7 hours drive away.
Là cháu Đồ đi ta quắc tay đi đo leo đồ Đi ta quắc tay đi đo leo mà phải gắn nóขึ้นปะตั้งครับ
ลงวัดมาทางนี้ก็คือเหม็นได้กลิ่นเย็นตรงนี้คืออะไรนี่คือเดินปกติ
ครับ เดี๋ยวเราไปทางสายกลางไป
แล้วไปขึ้นตรงไหนอ่ะ
ลูกขึ้นดูดีนักดีนะครับ
เอาแค่ตัวค่อยเป็นทางลัดเหรอ
ครับมันไปได้กว่านี้แหละ
เรือต้องไปเดินหน้า
เดินหน้าก็ได้เดินหลังก็ได้เลยถือดูไม่ไปขึ้นพิษโลมันเดินไปเลย
ขาสั่นขาสั่น
ดีแล้ว
ไปล่ะลูก
ครับ
เอาของที่มาเผื่อได้ไหม
ได้เอาอะไรอ่ะรถมอเตอร์ไซค์มันยังดีนะไม่ได้จินตนาการอยู่
ที่ดินยังไม่ถึง
nó bị ngơi rồi kêu băng đi ồ เฮ้ยก่อนกินนะโยนี่กลับไปเจอไปรับไอ้บูไม่ได้แต่บ้านอยู่เดียวคาดตัวเดียวกินหรอกจับรอดเห็นไหมตุ๊กได้ยังไงกี่ตัวเนี่ยมันใช้สมองแบบนี้
Doesn't the elephant get hot in the truck? How do they cool it down?
They normally stop at the gas station or wherever they drink water.
Oh, okay.
Them to drink water along the way. You didn't go like keep going, not stopping. They keep stopping
Right.
to get them to eat and like water to cool them down.
ได้
Because it's really hot.
Yeah.
อันนี้มาใช้ตัวนี้กันดิ
อย่างนี้ไม่ได้แล้วครับอย่าเลยเนี่ย
มาตัว
ป้า ฮะล็อกกับรถเลยนะมันเรียกว่ายุ่งกันไม่ได้ ยุ่งมากเลย
หลังไป
ไม่ต้องนะ
ไม่เดี๋ยวล็อกก่อนก็ได้เพื่อกันราด
โอ้ยัดแม่ยัดโรคกูแต่ไม่เอาอ่ะ
อุ้ย
เจอคนนี้เจอไหมเจอไหม
อุ้ย
น่า
อุ้ยอุ้ย
เจอคุณไป
อุ้ย
ขึ้นเยอะอันนี้ฮะขึ้นเล
อุ้
ย
ยว
าดชัวไปเอง
เดี๋ยวมันขึ้นแล้วมันต้อยลงล็อก
ไปยุ่งยุ่งแต่โก้จังไรเอาไปกลับไปเงาไปนะ
That is her Sharon's opinion about going up the truck.
มึงกลับไปหน้าแล้วกันตัวไอ้โอ้กันเดี๋ยว
ไปตายเมืองไม่เคยไปตีกัน
นี่จะไป
ไปนานเลยตัวนานเริ่มต้นกลับแล้ว
โอ้ไปเรียวคนก็เราไปตัวเราคือก็รักคนเราไปเราป้ายที่เรารักป้าตังอะไรนี่เลยซึ่งมาไปเลยโอ้คนตุ้งเก่าเลยไหม
แล้วใครเหลือพายสิงแล้วใครเหลืออะมาด้วย
มาด้วย
เดี๋ยวนะ
อีกว่าจะเป็นไหมอย่าไปจุ้งนิ่งได้ด้วยอย่างไรกันหลบหมดเดี๋ยวลงอยู่กันเห็นลูกเป๊ะ ไม่เน่เมื่อนี้ต่อเจ้าได้โม
ไม่หนีไม่หนี
เป็นโมเล่นขอบนมีกันที่ได้แหละ
And everyone is afraid of getting shit upon by the elephant, yeah? Has it happened before?
too many we get too many
Uh-huh.
เอาพี่เด่นไปกับนี่เหรอพี่มันไปส่งข้างบนหน่อยกลัวมากเลยนั่ง3 ล้อหลังจากตีลังกามาแล้วรอบนึงว้ายหมอคุกทำเองอย่าเลยมาเดินทางปลอดภัยบ๊ายบาย
So, what's this patient's name? The elephant?
This is Linda, female, 39 years old, from Phangna, which is she work locking work.
Right. And what is her problem? Why is she in the hospital?
Okay, so in the morning, the owner just called us, Azab, in the morning and informed like, Linda, she has the clinical sign that she tried to,
Defecate.
try to defecate, but is buried to do it.
Right.
And then immediately in the meantime, that is the same day that the owner want to relocate her from the rubber plantation back to home in Phangna. And then I said, okay, for now in that time we have patient in hospital, so we could not go out. So it's gonna be better for you to just like,
Come here.
Take her here directly
Right.
to the hospital, and then after we received her at the hospital, we put her on scale and we did blood collection and see the blood result, and also we provide medication on that, and then she could defecate.
Right.
But the point is like the order of the dung is be like abnormal things, so she's gonna be on drugs, on medications about 4 days, and then the GI tract of her is like back to normal condition, like back to functional again. And during the first few days, we observed, like notice she used her tail hit her genital area.
The
like
vulva.
often. So I'm just like, okay, what's going on? And then we just check on that and we found out, bam, like she got like a wound around her genital area.
Was it? Is it ulceration or abscess?
It's kind of like a ulceration, which is like is quite for a while, maybe like a week or something. And then yeah, so for now she's been here with us to treat the lesion of the wounds on
the
her
vulva.
genital area.
Right, okay.
Yeah.
How big is that ulceration?
The size is just like a coin of the Thai baht, which is like maybe
Centimeter.
3 centimeters.
Right.
And another one upper is like about 1 centimeters.
Right. Okay. And how long is she expected to be here?
I think she could be discharged soon.
Oh, okay. That's good. That's very.
Because we just stop antibiotic for like go straight to the skin problem.
Right.
And then the pus is less, and then the wound is quite clean. So I think like it's just like not that long. So
Right.
we could discharge her.
Right. Was there? You say some maggots in the vulva in the wound?
Yeah.
Yeah.
We found out on the first day.
Right. Okay. And how do you think the wound came about?
I think accidentally from work.
Right.
Because
okay.
she worked with logging, you know,
Right.
she might get accident and hit on the
branch.
branches or something.
Okay. All right. Okay. Well, it's good to hear that she's going to do the job soon. Thank you.
Thank you.
You're discovering any further problems for her? No more. Yeah.
Much better.
Much better, is it?
So for now, it seems like we have to. She has soft tissue problem, which is vulva, anal, oral.
Oh, oral as well.
Yeah, because of the. I think because it's kind of like the spike of the pineapple.
The pineapple, right?
Yeah. It's
Okay.
kind of like
Abrasive.
Huh?
It's abrasive.
Yeah.
Okay, whenever. Oh, hi on. And this is your pharmacy. I can see all the drips and all that here. Can you tell us all the supplies, how long each type of medication will last if you have 4 elephants in the hospital?
Okay, so we have 2 part of the section, which is like in this area is just like topical medical medicine things to use for supply, which is like this is saline to clean the wounds, and then that is like massage oil, something like that, and also this is the everything's for wound cleaning.
Right.
And then that is like syringe or things.
Right.
So back to this part, this is like the medicine that for injection.
Right.
Just the first one is for this is the antibiotic. You can see like this, the whole thing is empty because we use a lot. Like for example, this one
Metronidazole.
metronidazole, and then we have to combine with enrofloxacin, which is if per 1 elephant we have to use about 60 bottle
60, 60.
60, yeah, per day. So this is like almost all of empty because before that we have in stock about at least 500 bottles.
Right.
And then and then the rest is kind of like another antibiotic that we use like let's say about at least 15, something like that, but it's calculated by the body weight.
Right.
This is like for anti-inflammatory and also supplement injection like vitamin or something like that.
Right.
So this is like we are waiting for these the drug gonna be delivered because we have to always
Order.
prepare.
Yes, yes.
Yeah.
So, it costs a lot just to buy the drugs, yeah?
Yeah, and then another room, this is the room that we stock the saline drip.
Right, okay. Okay, thank you very much.
Thank you.
Guys, this is the veterinary team from the Southern Thailand Elephant Foundation, and this is
I am On. You can call me Dr. On. I'm a senior veterinary officer of the Southern Thailand Elephant Foundation.
and you are.
Hello, I'm me. I'm a junior veterinarian at the Southern Foundation.
You are.
Hi, I'm Phangna. I'm a volunteer coordinator, so basically taking care of the volunteers.
Okay. And you get a lot of volunteers.
We are having volunteer coming in recently because we just opened up for the volunteers, so they're like booking coming in. So welcome for everyone who want to come.
Okay, good. And if they want to volunteer, how would they apply to volunteer?
You can go to the website stepthailand.org.
Okay, thank you. Can you explain to me what the Southern Thailand Elephant Foundation is all about?
So, Southern Thailand Foundation, it is the charity which is like international, which is like registered in the late of 2017 in UK and also in Thailand. With the our founder Jake Jakapok, which is like he was in UK for years to study another bachelor and also one master in medical research, which is he knows Dr. Andrew Wiggins, the well-known British veterinarian. And then back to the background of Jake, which is like his family has elephant like for the since his grandfather. So the point is of the Southern Thailand Federation is we would love to provide healthcare and welfare to domestic elephant in the south, which is in the south there is only one elephant hospital belonged by the government, which is in the Krabi. And the location of that, this is like in the center of the south part of Thailand. And then 80% of cases there, which is from Phangna and Phuket. So Jake just like considered and want to focus on that because if something happened to elephant, which is like from Phuket and Phangna, it's gonna take about like 3 or 4 hours on the truck before gonna reach to there. So that's why STEF or the Southern Thailand Elephant Foundation has come up.
Yes. How many cases have the staff handled already since it started, more or less?
So approximately of the cases that since we start in November 2020 till now, it's approximately about 200 up cases. And mostly and the majority of the cases is about the GI problem, which is like gastrointestinal problem.
Okay. And are you getting more and more patients since you started?
Yes. From the beginning, like we are the new organization that we have to be part of the introduce ourselves to local owners and Mahmoud around here to say like who we are, what we are doing, our goal of the foundation. Yeah.
And how many elephants can you actually house in the hospital?
For now we have about 14 elephants already in the hospital since...
No, 4 or 14?
14.
14? Okay. So, how many elephants can you house in the hospital at any one time?
Maximum 4 to 5.
4 to 5, is it? And what is the limitation to 4 to 5? Why is there a limitation 4 to 5? Can you take more?
Because we have limit place to tag them in the night time, and also we have like a limit of the staff because we have only 2 veterinarians, we have 2 mahouts, and also we have Phangna who's like helping and everything.
Right. And obviously, treating elephant, you have to use a lot of consumable, right? So when you have 4 elephants, can you roughly say, how much consumable you use, things like fluids, medication, and all that, roughly?
So about food, I think we use about roughly 6,000 baht per week of the pineapple, the tip of pineapple, and then also, we luckily we got donation from the local people around here to donate banana stock and also some grass napier, which is like in a month we have to pay for minimum to 24,000 baht.
Right. Okay. And what about consumable, the fluids, the medication? How much you use in a month?
It depends on what cases about, but the strongest the cause is from GI tract problem, which is they use a lot of fluid, a lot of medicines, long time, and it also like take times because mostly we got like very like elder elephant, which is like take a prolong of the protocol to treat. And the minimum, like, since we have the inpatient in hospital, at least 2 weeks.
Right, okay. And each elephant, say, if you need to give drips, will take what, between 20 to 30 liters of serum?
I would say in the average is like 50 liters per day.
Right, okay. So if you have 4 elephants, that would be 60 liters per day.
Correct, something like that.
It's all on GI, yeah? So that's a lot. And if you count it out, 60 liters times 7, 60 times 7, my math is not so good, but it's a lot. Then the food, you said that the elephants eat a lot, of course, and one small truck will feed 1 elephant for
one truck for 1 elephant for 1 week. So which is like 1 truck, if we have 4 of them, so it could be like only 3 days.
Right.
So let's say like it's about average 3 trucks per week. Because some of like because elephant they eat all the time, except they sleep, so they can just like consume it.
Right. And then your work hours, because there's no such thing as 9 to 5. Yeah, your work hours can be long depending on the cases, right?
Yes.
You say that you've been working non-stop for how many days? Some of you?
I think since we have the case of the 60-year-old female elephant who just came from Phuket with about the condition of the colic things.
Yes.
Today it is like 19 days already. But she just like fully recovered in the past like couple of days.
Okay.
That she could like the GI tract back to normal condition and functional. So we don't have to stay at the night or over the night. And
Okay, very interesting. Otherwise, it's very long hours and it's very tiring, yes? Okay. All right.